Good afternoon, Peter Goertz. I'm a psychiatrist. Can coworkers be difficult to interact with? I'm just kidding. That definitely can happen, of course, and I'm pretty sure you've experienced that also. Are you being treated unfairly at work at this point? Are you being passed over for promotion? Having knowledge, being good at your work, let's say in medicine, having book knowledge, you can know all there is to know about psychopharmacology. But if you're treating patients, you're going to work with a team of people, you're going to work with staff members. So you will need to have interactions with staff members, and they need to be as good as possible. So that can be a challenge. And I've heard that also quite a bit from patients. So patients can come in and say, oh my God, my boss is harassing me. I really can't stand it at work, but I don't want to leave because financially I would really be in a difficult spot if I left. Medical insurance, things like that. So there can be really difficult decisions. And I myself, over the years, have had more trouble overall interacting with certain staff members than overall with patients. So that is an issue to pay attention to. And we want to be careful, of course, that our interactions, if they're negative, for instance, with staff members, do not affect patient care. So one example is when I was an intern in an emergency room, pediatric emergency room actually, I was trying to get a nurse's attention, and the nurse just kept on ignoring me, and I tried, and then finally it was in the middle of the night. I thought, I'm just gonna go get some sleep, I'm gonna lay down. And then sure enough, there had been a miscommunication, and the patient, a child, got too high a dose of medicine and was sedated in the morning. So in that case, the poor interaction between myself and the ER nurse directly affected patient care, which is a real problem. Another example is two of my colleagues, when I worked on a hospital ward, were not getting along, just shouting at each other, and probably patients could hear them. So again, if we're trying to help patients deal with emotional problems and they see us shouting like on the Jerry Springer show, probably not a great example. Another example is a supervisor once told our team on a patient of mine, regarding a patient of mine, to do something that I really felt was unethical. And that, of course, presented a problem. And I feel bad to this day. I did not do what he wanted us to do, but other people on the team did. And it really, to this day, I do not feel good about that whole situation. In my experience, big bureaucratic institutions can attract some people that are not very motivated to work necessarily. They tend to be focused maybe on getting the benefits, a good salary, health care, money in retirement. So that type of situation can be very difficult, because if you have a certain percentage, maybe even a large percentage of people in an institution that are not very motivated, then the people who are motivated have to do a lot more work, and that can be a very difficult situation for those people. I've heard about people being directly harassed, openly at work, sexually harassed, emotionally harassed, and let's say someone's tires, a staff member could use a knife to puncture someone's tire in their car. So really bad things do happen, and that can be difficult to cope with for coworkers and for the person whom it happens to. People can call in sick. Let's say a colleague of yours calls in sick, and because of that, you have more work to do maybe. So of course, then you can have some feelings about that. And in these situations, it's good to set boundaries as best you can. So you really don't want to be treated unfairly, of course. And if necessary, contact superiors. Now, of course, it can be that the superiors are the ones who are treating you unfairly. So that creates a very difficult situation then, because if the main people treating you unfairly at work are your superiors, then it can be difficult. I mean, you can try and go to their superior, you know, even higher up the chain, but potentially that can be quite difficult. So in general, it may be better to leave your job than to be in a job where you're treated unfairly. And of course, then you want to ask yourself the question, do you want to work with people, let's say, who puncture your tires, who are harassing you openly? And that may help you to make the decision, wow, I don't think I can stay here, or I'm going to stay here, but I'm really going to make sure boundaries are set, if that's possible. And another aspect is, if someone is being treated unfairly, let's say being passed over for promotion, being not paid fairly at work, that type of thing can happen more frequently, or people who've been abused, let's say in childhood, sexually, physically, emotionally, they can be more vulnerable down the road to being abused later on in life, let's say at work, for instance, by not being paid fairly. And it's never about blame or fault, but if that is your pattern, it's wise, most likely, to be in psychotherapy and address that, so that hopefully in the future you will not be vulnerable to being, or more vulnerable than average, to being abused or treated unfairly. Thank you.